welcome to this video. It's good to have you back. If you are new here, hi, my name is Priscilla. Welcome to this channel. In today's video, we're going to be talking about 10 things that I wish I knew before becoming a plastic surgery nurse, or that I just didn't know going into this field. I have been a plastic surgery nurse for about a year and a half now, and let me tell you, this is so different from being in the hospital, and it has its pros and cons, but mainly pros. So today we're going to get to some of those things that I wish I knew going into this field. There were a lot of other things I could have included in this, but I'm trying to keep it kind of short. And I also can't think of everything off the top of my head that I wish I knew, but these are the main things that stick out to me the most. If you're new here, welcome, and I hope you like this video. I hope you find it educational, entertaining. Hopefully it gives you some insight on this profession. There's not a whole lot of YouTubers out there that are plastic surgery nurses, not that I know of from what I've researched, so hopefully this gives some information out to you guys that are interested in this field. I get a lot of messages from you guys saying this is like your dream profession, this is why you want to become a nurse and why you're in nursing school. I even get comments from doctors saying I wish I would have gone into this field. So I know it's like highly researched field, but there's not a whole lot of us in it, not as much as like in the hospital. I'm interested in knowing what other kinds of videos you guys want to see, so drop your suggestions in the comments below. I really enjoy talking to you guys in the comments and interacting with you all. Another way you guys can reach me and see what I'm up to is by following me on my Instagram, so I will leave it here, and I post on there almost every day, so you guys can check that out as well. Another way you guys can keep up with what I'm up to is by going to our vlog channel. It's called Priscilla and Johnnie, and we've been posting on there a lot because we've had more time on our hands. So without further ado, let's jump into the video and let me tell you what I wish I knew. The first thing I wish I would have known is that I could have started sooner. Although I will say, when I first saw the job posting, it did say that they were looking for an experienced RN with at least 3 years of experience. Now, I don't know what other plastic surgeons' criteria for this is. It might be more, it might be less, but at least for me it was perfect timing. I had been a nurse already for a little over 3 years, I think. The timing was perfect in my case, but if I wouldn't have found that job application, I probably would have gone years and years like not really knowing that I could get into this field. Like in my earlier years of my career, I thought that maybe I needed like a decade. Like, I don't know why I thought that, but with that being said, I don't think there are plastic surgeons offices hiring like new grad nurses. I think you need some experience under your belt, and honestly, with the experience that I got in the hospital, like having 1 or 2 years of experience would have been enough for me to feel comfortable doing what I'm doing. A little background for those of you who've never watched a video of mine before: I used to work in the hospital as a critical care nurse in PCU, and I did various specialties. I went through cardiac, spine ortho, multi-system PCU. I did several things, but I never worked in anything close to plastics. The next thing that I did not see coming is how much of like a family we are, at least in our practice. Everybody's so close, because you gotta remember, like in the hospital, there's just like so many people working in the hospital, and yeah, you might be really close to the people in your unit, and you might have like build those really close relationships, but you don't necessarily work the same shifts. And I found that when I used to work in the hospital, I would have kind of semi-close relationships. It was really rare that our schedules matched up exactly the same, but working in plastic surgery, I work Monday through Thursday, so I have more opportunities to see my coworkers, and we spend a lot of time together. The next thing I did not know going into this field is that we were going to be on call. So I'd never been an OR nurse in the hospital. I have always worked on the floor, so I had no idea what on call really entailed. We take turns being on call. We're like on a schedule. You do get compensated for being on call, and what being on call entails, at least in my job, is whoever's on call is on call for 1 week, and it starts when the phones go off. So after 4:30 p.m. we're on call until the next morning at 8 a.m. when we open again. So in that time, a lot can happen, especially if we've had surgeries, if we've done procedures on patients. So we can get phone calls like in the middle of the night. So I always try to keep my phone on sound really, really loud next to me. When I go in the shower, I put it really close because I've gotten calls while I'm in the shower. Yeah, I didn't see it coming. I totally see why we have to be on call, because we do surgery obviously, and we have actually gotten some emergencies. It's very rare that it happens, but it does happen. I've even had to come in for an emergency. I want to say that was like when I just started being on call. I was just learning how to be on call and like how to answer the phone calls, and what to say to patients. And then I had this huge emergency that I had to go to. I came home I think at like 2 in the morning. So that was just something I didn't think about. I don't know why. Speaking of surgeries, the next thing that I wish I knew was that some days, it's very rare when this happens, but sometimes surgeries run later than expected. There are times where we're still at work and it's like 7 or 8 p.m. There are times where we have like lots of surgeries back to back. If you work in surgery, you know you can't really predict every little move. Like, yes, things are very structured, but once you get in there, if that patient bleeds a lot, that patient bleeds a lot. Even though it ends up being a really, really long day and we have to be back the next day, I don't know, I kind of like the adrenaline kicks in at some point that if we're extended that much, they'll actually order us some dinner, which is really, really nice because sometimes we break for lunch early, like at 11, but like I said, it's super rare, and yeah, it's not a big deal. I just make arrangements with my husband, and he sometimes is still stuck at work, so it works out. And the reason why I have to stay longer is because I usually work the later shift. I come in at 8 because I'm usually in the recovery room, so if surgeries run really late and I have to stay till like 7 or 8 or something like that, then I'm able to do it. And the nurse that opened and started the cases at 5 in the morning doesn't have to stay all the way until the end. So we kind of break it up that way so we are not working all these crazy hours. Another thing I didn't really see happening until I started working there was how close of a relationship we build with patients. A lot of times patients tend to be like a work in progress. Patients go through a transformation that takes several surgeries, several visits, and you end up seeing them for like a whole year, multiple times that year. Even if it's a patient that has one surgery with us, sometimes they come in for a facial or for Botox or filler, and we just tend to see them throughout the year, so we get to like ask them, how are your kids doing, how's work, whatever. And yeah, it's really cool seeing their transformation from the beginning when they come in and they have all these concerns and they just want to change something about themselves to feel better and look better, and then they go into surgery and I'm with them there and recover them, and then they come back for their follow-ups and I see them again, and just seeing that transformation is really, really cool, and getting to be getting to know their lives and like educate them, educate their family members. Now with that being said, the next point that I didn't know how close things would get is that patients would email or text or even call us at like really weird random non-office hours, and they have a way of contacting us through email, at least, especially if we've emailed them once before. So sometimes they'll just like reach out to us for something completely unrelated, or about another person, or about a different subject that has nothing to do with what we previously talked to them about. Yeah, that's something I just didn't expect. Sometimes they'll like even text or call outside of business hours, and that's just like, I don't do that. There are some people that do, but I like to keep my personal life and my work life separate. It's not something that we did in the hospital. And of course, like, I'll just respond to them when I get back to work. It's no biggie. The next thing I didn't know was how rewarding it would be. Like I mentioned earlier, I get to see almost every patient go through this transformation, and it's just like super rewarding. The times that I feel this like overwhelming, rewarding feeling. I don't know if you guys have felt this before, if you're a nurse, or if you're like, if you just help people in general, like you've probably felt this, but when I transport my patients from the PACU and I get them dressed and all ready to go, I wheel them down and I take them to the car, and their spouse is there usually, or a family member, and I just like put them in their car, I buckle them in, I just like make sure everybody has their things and their post-op instructions, which I've already gone over with the family member prior to leaving. So that part right there, like just getting them ready to go home safely, like that part, I don't know why, almost every single time it brings me so much joy. Again, I have no idea why, but it just makes me feel like my patient is taken care of. They're going off to their new stage of like recovery, and like I did everything that I could to help them. Usually at this point their anesthesia is worn off, so they're able to talk more and like just smile and just talk to me about life while we're waiting for the car. And it's like I get to talk to the patient more, and I get to be in a very vulnerable spot with their family member that is having to take care of them, so they're trusting every single word that I say for them to take care of their loved one. And it just brings me so much joy to be able to be a part of that process to make sure they go home safely and happily. The next thing that I wish I knew was how much autonomy and freedom there is, at least in my practice. We're able to have like more autonomy and freedom than you normally would in the hospital. Obviously sticking to protocols and policies and standing orders and things like that. But it's really cool that we're able to develop like new standardized ways to improve care. So we take our time and effort to make sure that things are really easy and simple for our patients. It helps the patients be less confused, less anxious at home. Another thing we get to do is make our post-op instructions or modify them as we need to. If you think about it in the hospital, when you give your discharge instructions or education to your patient, you kind of just print it off of this database in the system, then you give it to them, but you have no control over what that says. But in our practice, we get to organize things in a way that's easy for the patient to read and using verbiage that's easy for them to read and understand. I've actually been a part of this, and I've been able to modify instructions to be just more reader friendly for the patients. And there are other ways that we have autonomy and freedom, but that's just what comes to mind right now. The next thing I wish I knew before becoming a plastic surgery nurse was the different kinds of work that I would have to do that are not necessarily like nursing work. Stuff like cleaning, organizing, stocking supplies. I mean, all these things are done for us in the hospital, so we have to process our own instruments. We have to clean and disinfect the whole OR after our cases. We have to fold and stock the linens. Besides that, there's like other office work that I'll have to do. It's because it's an office setting, so we don't outsource a lot of these things. We have to do it ourselves. And last but definitely not least, this is my favorite one I think so far, is that I get to use my talents and abilities and creative side a lot, and especially now more going in the future. I might get into that in a different video, but basically I'm bilingual, so I'm able to use that ability to translate post-op instructions, translate documents so that Spanish-speaking patients can understand, as well as being able to translate during consults and for surgery and after surgery. So that's really cool. I'm able to tap into my creative side a lot more in this job than when I worked in the hospital. And I didn't really see that coming, even though plastic surgery is obviously more creative than any other medical field that I can think of. I'm able to help with like some things in social media. Another cool thing is like the fact that I do YouTube and I'm on camera, I'll be able to help with in that sense. These are just a few things that I could think of. I do have another video that I made about a month ago, and it's titled 10 Reasons Why I Love Being a Plastic Surgery Nurse, so I will link that video here as well, so that way you guys can check that out if you're interested in knowing more about that. I will leave other plastic surgery videos that I've done in the past as well down there for your convenience. Let me know in the comments below if you enjoyed this video, if you are wanting to be in this field and what draws you to it, and also what other kinds of videos you guys would like to see next. I do like nursing videos, vlogs, style videos, beauty videos. I just did a pantry organization video I didn't know I was gonna do. Don't forget to subscribe to this channel so you don't miss out on my future videos. Don't forget to hit the notification bell because I don't have a filming schedule yet, and I just kind of will sneak up on you and you won't even notice that I posted something. So hit that bell, and also follow me on Instagram because I post on there almost every day. I'm gonna let you guys go, and thank you so much for watching, and I'll see you in the next one. Bye!